Hey guys, so I decided to do an article that's called The Effects of Music Therapy on the Interaction of the Self and Emotions. And I chose this article because I am also doing my own research on how lyrical content affects our well being and our emotions. And a lot of the resources that I also used for my research paper are studies done in music therapy. So, the purpose of the article and the study that they did was to analyze how music therapy affects personality dimensions. So, this can be self awareness, self esteem, effective communication strategies, and change in emotions. The study also wanted to analyze how personality dimensions and emotions are in patients who use music therapy versus patients who do not use music therapy. The study was conducted during the course in patient treatment in a general psychiatric hospital. So, the method that was used for this study was a quantitative method while also using a cross sectional study. And so, this would be like an observational study while the patients were in treatment. All eligible patients were asked to fill out a questionnaire regardless of any experience in music therapy, and no previous music knowledge or ability was expected from the patients. And patients were given an informed consent. The questionnaires were handed out to the patients, and then were asked to return the questionnaire anonymously in a closed envelope within 1 week. So there was a collection of data collected from 137 patients, and the ages were 18 to 66 years old. The questionnaire was a self assessment questionnaire, and all patients were treated with a routine psychiatric inpatient treatment program. 82 patients were additionally treated with music therapy, and 55 patients were not treated with music therapy. So the patients were just going about their day as normal and using the clinical needs that were given to them as per usual, except there was a group, so the 82 patients were given music therapy also. And the questionnaire and tests were built upon patients' experience in the music therapy sessions and the non music therapy sessions to see how music therapy helps with personality dimensions versus those who do not use it. So the results were the music therapy group that had low self worth used music for problem solving and used music for fun. The non music therapy group used music to help with their negative feelings in their everyday life. So they found that the group that used music therapy, it really helped them to kind of get out of their heads and be present. So in the sessions, they give you instruments to play and to sing and to just use music as a way to help with your emotions. And then the people who did not use music therapy still use music every day in their lives and used it as a way to cope with negative feelings and negative emotions. So the music therapy group, again, used music to engage with life and to be present. And the non music therapy group identified music as a way to help with their emotions. So an interesting quote that was read, or that I found on the article, was that music can be helpful for emotion modulation in the everyday life of patients with mental disorders. If music therapy is applied, specific personality dimensions predict more targeted emotion modulation strategies, whereas patients without music therapy simply vent their negative emotions, and music therapy seems to help patients acquire more conscious emotion modulation techniques by means of including their individual personality. So, with the results, they did find that music therapy really does help patients with mental disorders. However, the challenge was that this was the first study on doing music therapy on patients who are in a psychiatric hospital. But they also did find that music in general helps people and helps people with their emotions and their well being. So, this was a really interesting article, and thanks for listening. Now, go do your discussion posts.